happy to join you today as we celebrate Cook County Health's latest expansion of services being offered. Over the last year, the health system has made incredible strides to elevate and expand services being offered to our patients. Earlier this year, we gathered to celebrate the launch of the Robotic Assisted Surgery Program, and then came together again a few weeks later to cut the ribbon on the Advanced Neurosciences Unit. These investments are investments in people and technologies and directly help improve and save patient lives. I'm grateful to the health system and clinical leaders who advanced this program. Dr. Makaitis, Interim CEO of Cook County Health, Craig Williams, Dr. Nancy Casada, Dr. Ann Levinson, and Dr. Jay Patel. These are a few of the many people who've worked behind the scenes to get this program launched. We're grateful. Because of their work and now the work of doctors, nurses, support staff, and more, patients will have access to technologically advanced lung cancer screenings. The ION Robotic Bronchoscopy will help patients receive timely and more accurate diagnoses, which leads to better outcomes. This is especially important because, like many health conditions, there's a notable disparity when it comes to diagnosis and outcomes. According to the American Lung Association, Black folks with lung cancer were 15% less likely to be diagnosed early and 16% less likely to survive 5 years compared to white people. Meanwhile, Latino individuals with lung cancer were 16% less likely to be diagnosed and 9% less likely to survive 5 years. A person's race, ethnicity, zip code, insurance, or ability to pay should not determine what kinds of care they received. It's important that everyone in Cook County, everyone, has access to the types of care that will allow them to live their healthiest lives. Again, I'm grateful to our health team, which continues to innovate and serve our patients so well. Now, I'd like to ask Dr. Makaitis to come to the podium, and if each person would introduce the person who follows, that would be helpful. There you go.
Okay, thank you, Madam President. Good morning.
Good morning.
I'm thrilled to be here today to celebrate the launch of our ION Robotic Lung Biopsy System. This milestone, one of many marked this year by Cook County Health, wouldn't have been possible without the support of Cook County Board President Toni Preckwinkle, the Cook County Board of Commissioners, and the Cook County Health Board of Directors. Their support of our health system's initiatives is critical for us being able to make investments in new technologies. But make no mistake, these investments aren't just about new machines, they're investments in the lives of Cook County residents. This system will allow Cook County Health doctors to perform minimally invasive biopsies of the lung, which will improve precision and safety and lead to earlier diagnosis and better outcomes for our patients. Lung cancer is the second most common cancer in men and women, and by far the leading cause of cancer death in the United States, accounting for 1 in 5 of all cancer deaths. Here at Cook County Health, we've worked to increase education and access to lung cancer screenings. In 2023, more than 960 patients underwent lung cancer screening. This is critically important. Early detection is key for good outcomes with lung cancer. Unfortunately, only 21% of lung cancers are diagnosed when the tumor is still localized. Lung biopsies are critically important for diagnosing cancer early, and this robotic navigational platform allows doctors to get to tumors in areas of the lung that typically would require more invasive approaches. Thanks to this investment, we'll be able to get patients the testing they need with higher diagnostic accuracy and less risk of complications. I'm particularly excited to celebrate the launch of this program because there are fewer than a dozen academic hospitals in our county that have this robotic system. By bringing this technology to Cook County Health, we're taking a huge stride in advancing health equity by creating access to minimally invasive biopsies for residents of Cook County, no matter their insurance or immigration status. I'm incredibly grateful to our clinical leadership, Drs. Fegan, Kumapoli, Hart, Tulimat, Levinson, and Patel for leading the charge on this project, and for the other departments whose partnership made this possible, including nursing, radiology, surgery, anesthesia, sterile processing, and materials management. Thank you again for being here with us today. I now have the pleasure of introducing Dr. Levinson, who's going to share some more details about this great program.
Thank you, Dr. Makaitis. Good morning. My name is Ann Levinson. I'm a pulmonologist, and I'm the director of the Pulmonary Procedure Suite. Oh, sorry.
go. There we go.
Very short, sorry. Okay, thank you for inviting me here today to speak about the new ION Robotic Bronchoscopy system here at Cook County Health. As Dr. Makaitis noted, this is the culmination of work done by a large team, many of whom are here today. I want to give special recognition to some of the key people who move mountains to make this a reality and who continue to play an integral role in the program. Dr. Tulamat, Dr. Patel, Craig Williams, Joe Teves, Heather Lovelace, Dr. Feng in the radiology department, James Dobbs, Renee Jackson, Doreen Hoxema, Regina Houston, Denise Fagan, and our entire bronchoscopy staff. Thank you so much. Lung cancer is the leading cause of cancer death in this country, and here in Cook County, more than 2,000 people per year are diagnosed with lung cancer. Because lung cancer doesn't cause symptoms until the disease is advanced, more than half of patients with lung cancer are diagnosed at a late stage. However, when lung cancer is caught early, the survival is much better. Early detection is key to saving lives. Here at Cook County, we already had a robust lung cancer screening program to look for early lung cancers in our patients at highest risk. However, once we found a potentially cancerous nodule, it was often difficult to reach it to test it for cancer. This caused delays in diagnosis or the need for higher risk procedures. That's why Cook County is investing in technology that improves the early detection of lung cancer. The ION program improves our ability to reach small nodules in hard-to-reach areas of the lung, lowers the risk of complications, and increases diagnostic accuracy, giving more patients the chance for a cure. With the ION Robotic Bronchoscopy system, we can easily create a map with a route to the concerning nodule. We then navigate the robotic catheter through the lung to that nodule and take biopsies to figure out whether or not it is cancer. This is a safer and more accurate way to diagnose early lung cancers. Our patients can then move rapidly to treatment, including robotic surgery, to give them the best chance for survival. I'm thrilled that our patients now have access to this high level of care as we advance the historic mission of Cook County. Thank you. And now I'm going to introduce Dr. Nancy Quesada. She's the Director of Ambulatory for the Pulmonary Division.
Muchas gracias. Soy la doctora Nancy Quesada, acá neumóloga en el Cook County Health. Estoy encantada de estar acá celebrando el lanzamiento de nuestro nuevo sistema robótico ION. Este sistema representa una inversión tanto en tecnología como en las vidas de nuestros pacientes del condado de Cook. Este sistema nos permitirá llegar a biopsias de pulmón mínimamente invasivas, lo que mejorará la precisión y la seguridad de estas biopsias. Nos ayudará a realizar diagnósticos tempranos de pulmón con mejores resultados. Un diagnóstico temprano de pulmón hace una gran diferencia. Según la Asociación Estadounidense de Pulmón, conocida como el American Lung Association, los individuos latinos con cáncer de pulmón tienen un 16% menos de probabilidad de hacer diagnóstico temprano y un 9% menos de probabilidades de sobrevivir 5 años. El cáncer de pulmón es el segundo cáncer más común en hombres y mujeres. También la principal causa de muerte de cáncer en Estados Unidos representa 1 de cada 5 personas que mueren por causa de cáncer. Las biopsias de pulmón son fundamentales y un diagnóstico temprano de pulmón nos hace la diferencia. El sistema ION robótico en el que ha invertido el Cook County Health nos ayudará a hacer diagnósticos tempranos cambiando el pronóstico de las vidas de nuestros pacientes. Muchas gracias.
All right, next is Dr. Patel, is that right? No? No, okay.
Okay.
Well, he's giving us a demonstration, is that right? Perhaps for the benefit of our cameras, you could tell us what you're doing.
Yeah. Okay, so we're going to see if we can try to get this demo started and just really highlight the technology of how we really get to some of those really hard to reach tumors in a patient's lungs.
This isn't how the actual system looks. It's going to be in use today, so that's why we didn't bring it up here, just so that we could use it for patient care. But this is just a simulator that's going to show kind of what it looks like. But it's taken its time to turn on, sounds like.
Okay? Two rows or one?
Two rows, so we'll take
Okay, so sorry about the technical difficulties, but I think we got it figured out. So if we can zoom in on here, this is what Dr. Levinson was talking about. So this is a 3D representation of our patient's lungs. As you can see, this is really like...
You want me to narrate what you do? So the image on the right would be the real airway view, and the image on the left is the map. So it's kind of like Google Maps. It really shows you exactly where to go, which is very helpful. And then you just navigate using this controller, which is similar to the one that we have in the bronchoscopy suite. And you can see how quickly that he can navigate right to the area where the nodule is. So it just makes it so much quicker, so much safer, so much easier to biopsy these nodules. It's really helpful. So yeah, before, if either we might not be able to attempt the biopsy with the bronchoscopy at all and might have to either do a biopsy from the outside that's higher risk or do a surgical biopsy, which is even higher risk. Or we might try to navigate to this area, but it would take a lot longer and there would be more chance that we wouldn't get an answer. So the yield with this procedure is about 80% compared to historic methods, which were closer to 50%. And we've already had a couple of patients that we've done personally that we tried to get a diagnosis using the old methods and we couldn't, and then we biopsied them using the ION and we were able to get a diagnosis, including diagnosis of cancer. So that's really impactful for the patients.
Also imagine that recovery time is shorter because of this. Can you tell us about that?
Yeah, so the risk profile for the procedure is very favorable. So there's about a 2% risk of bleeding, 2 to 4% risk of pneumothorax, which compares favorably to some of the other types of procedures that we might have had to do to get a diagnosis.
And more generally on lung screening, who's at risk for lung cancer and what should they be thinking about to prevent cancer?
Yeah, great question. So smoking is the biggest cause of lung cancer. So if you're currently a smoker, I really encourage you to quit. We have a lot of different resources here at Cook County to help you. Even if you've already smoked for 50 years, you can still benefit from quitting smoking now. But lung cancer doesn't only affect people who smoke, it can also affect those who haven't smoked. So in terms of screening, the highest risk folks, which are those folks that have smoked for many years, we have a lung cancer screening program here at Cook County where we would do a yearly low-dose CAT scan to look for any early signs of lung cancer. And lung cancer is so much easier to treat and people have such a better survival if it's caught early. So after we do that scan, if we do find something, we can potentially use this ION system to biopsy that spot, find out if it is cancer, and if it is, then that will give them the opportunity for cure. If we wait until someone has symptoms, you know, they can be at a much more advanced stage.
Anything else you all want to add from a clinical perspective?
No, just so we've already seen the benefit of this. We've done some cases already, and we've had patients who we were not able to get a diagnosis before, and we were able to with the ION. And then also some patients where we wouldn't have even attempted, that we were able to get that diagnosis quickly so that they can go on to get further treatment that they need.
Yeah, I think just a little bit to add to what Dr. Levinson said, just quit smoking and ask your doctors if you qualify for lung cancer screening. I think that's the most important point that I can highlight, is just screening, because the earlier we catch these, the better the outcomes are going to be. And this really just highlights, physicians working with hospital administration, that, we're able to help our patients. This is a win-win situation. We diagnose things early. It's better for the hospital, better for us, and it's better for patients. So I really want to say a big thank you to everybody.
También quiero recordar a los pacientes, dejar de fumar es lo más importante, y tenemos sistemas muy fuertes de screening de cáncer de pulmón, así que estamos acá para ustedes.